Hello, everyone. This is Dr. Ware coming to you live. I try to come live every Wednesday between 10 and 2-ish. Lately, I've been doing it at 2 o'clock, so I'm going to try to keep it around between 10 and 2:30-ish every Wednesday to give you health talks. The reason why I'm giving health talks is because there's a lot of information out there. I call some of my patients Google doctors and things of that sort. It's a lot of information about natural products, pharmaceutical products, different health myths and things of that sort. So what I like to do is I like to come in and give you, again, a scientific rundown of different issues that I either have with my patients or I have dealing with a lot of questions I have on social media and or new products that we're also developing for Healing Blends Global as well. One of the big things, and I think it affects, I think the latest count was 50 million Americans here in the United States alone, is arthritis. And the reason why I'm going to speak about arthritis today is because of the fact that there's a lot of myths about arthritis. You know, when you crack your knuckles, people like, stop doing that because you're going to get arthritis. Don't sit a certain way, it's arthritis. Or, there's different aches and pains inside the body. Oh, it's my arthritis. But a lot of individuals don't really know what arthritis is and how you really get it. Largely, there's a lot of research that has come out about arthritis in either natural products or even pharmaceutical products. The paper that came out actually just last month in June with a lot of wealth of information that was put out by the Association of Rheumatology about arthritis and a lot of natural products and why these things are really working. And that's one of the tips and one of the secrets I'm going to tell you about. Essentially, what is arthritis? Anything with itis on it is inflammation. So arthritis is just the articular joints that are inflamed. And the inflammation can cause pain, of course. It's going to cause inflammation, as well as going to cause some sort of erosion of either cartilage or the bone and the cartilage as well. Now, what are the causes of arthritis? That's the trick. That's the thing that a lot of individuals don't really understand, and they only try to affect one part of it. What really causes arthritis? Well, largely genetics. Genetics is a major cause of arthritis, but another major cause of arthritis is dietary things. Overwork. If you have a job where you have a lot of repetitive motion, you can wear down your joints and things of that sort can also create it. And then you can also have autoimmune disease that creates it, like with juvenile arthritis. I have some patients with juvenile arthritis, unfortunately, 14, 15, 16-year-olds that have flare-ups inside their body. Now, the reason why I say it's genetic is because of the fact that we see over a large spectrum that if one family style is more prevalent or one family type is more prevalent from different regions of the world, different types of arthritis may be more prevalent, more so osteoarthritis in the joints, the knees, the knuckles, and sometimes just in the spine. The most common thing that I see with a lot of my patients, especially if they had any sort of spinal, because again, you can have arthritis all over your body, even in your joints inside of your jaw. You can have arthritis there. You can have arthritis in virtually any joint inside the body. What it basically means that your synovial fluid, or what lubricates the body, has been worn down, and there can be some sort of cartilage damage or loss of cartilage in those areas, and as I said before, also bone damage. Now, the reason why genetically is probably because, again, work styles, lifestyle can actually take that into consideration. But there are 4 factors as the reason why a lot of the medications that are on the market for arthritis just doesn't work, because they're only trying to affect one thing. Mm-hmm. Their theory is if we affect the inflammation inside the body, then we are going to stop the arthritis. We're going to stop either the pain or we're going to stop anything from happening. But we found out really quickly that was really false. Back in the day, years and years ago, we would either give like steroid injections or prednisone, things of that sort, to actually stop the inflammation. And it worked for a little while. But we're noticing that the continuous steroid use was actually wearing away at the tendons and also ligaments and also the cartilage in the body too. Then second, what it was doing was it was actually affecting the kidneys and also the pancreas. So a lot of individuals that were on steroids, you saw seeing them like really gain a lot of weight, as well as they had diabetes and other things. So that's when it came with the NSAIDs, non-steroidal inflammatory drugs. So that's the aspirins, the Tylenols, the acetaminophen, Advil, things of that sort. That's again just only attacking one aspect of it, and that's the inflammation, and then it add the pain part in there. Long-term use of aspirin, GI tract inflammation, also bleeding as well. Long-term use of acetaminophen or Tylenol, things of that sort of the same thing. It's going to break the body down, and it's also going to start to affect the liver. So that's why they came up with the aspirin creams. But again, aspirin cream is still a same component of aspirin as well, because it's the salicylic acid that they're using that was derived from the natural willow tree that created aspirin, that created aspirin cream, that created all these things like that as well. So again, it goes back to a natural source. But again, when you have one component, one phytochemical doing something, it is going to wreck the entire body. So the COX-2, or what creates the inflammatory response after the histamine response, is what they were talking, the COX-2 response, over and over again. And then, as you see, the Humiras and these different drugs on the market, they're trying to do, again, one or two things here and there. And thank you for the love. I keep seeing people pop up and here and there. So thank you, everyone, for joining us. I truly appreciate you enjoying the information. So all these medications, as you see, long-term is going to cause some sort of issue. So what we started to do here at HBG, as well as some other natural sources, have seen that a big thing with the market, and a big thing that people are promoting, is anti-inflammatory. You'll see the turmeric, you will see the ginger, you'll see the aloe leaf, you'll see the ECGC, which is a derivative of green tea. You'll see, you name it, so many different things on the market that's for anti-inflammatory, either for arthritis or cancer, or all these other things. Do they work? They work beautifully. They work very, very well. And the reason why they work very, very well, the main reason why it works very well, it doesn't just do one thing. It does many different things. So the research that came out with turmeric, which the active ingredient in turmeric is called curcumin, has been shown that it doesn't do long-term damage to the stomach. It actually reduces inflammation systemically throughout the entire body, and the kicker, it actually can help reconstruct bone. What that basically means, if you have any bone loss, or what happens when the people get those real funny looking joints, and the joints are all different ways like that, that causes the osteoblast. Means that the cells that create your bones are now growing with all this inflammation. It's not growing effectively, so it's causing that bone to lay down improperly inside of your joint. So it's causing them to actually crinkle up and be deformed. It's been shown that taking, not just, I'm just giving you an example, not just taking the curcumin or the turmeric can stop that, but it has, combined with other things, can actually stop that from occurring, as well as it can also help it reconstruct the bone cells to stop having that effect be long term. So it's a beautiful thing. Same thing with ECGC. It'll help the COX-2 response, but in a natural setting as well. But what happens? Let me back it up a little bit. What happens is all this stuff is mediated in the stomach. This is the reason why I said a big major beyond the genetic is the dietary response as well. It's been shown that a lot of individuals that have a situation where they have arthritis going on, they could have an inflammatory diet, which means lots of dairy, lots of wheat, alcoholic beverages, sodas, and things like that. So they're not having the proper nutrients in their body. So the body's going to do what it's going to do. It's going to keep creating the inflammation to try to calm the body down. But again, that inflammation and that joint pain is just a precursor, or it's just a sign to say, look, you're not getting the proper nutrients in your system to help calm the actual body down. So what it's going to keep doing is keep producing it over and over again until it starts to go haywire, and that's why the joints look funny. That's why you wake up in pain almost every morning, and all these other things start to occur. Again, diet. So again, the reason why the whole situation happens great with the turmeric is because, again, it's creating the inflammation to go away inside the body. It's causing the turmeric to really release the inflammation out the body as well. Other things that can actually do that, again, as I was saying, it was ginger, is a whole host of things that can actually do this. And this is a long conversation, and I'm going to definitely do a part 2 of this talk. But diet is a huge one. So when I tell patients about not being on dairy, not being on wheat, it's not because of the fact that I'm anti dairy, I'm vegan or whatever. It's because of the fact that it's been shown that by your body producing extra mucus inside of your gut, because everyone has that lactose intolerance, or you feel like that phlegm start to come up after you have some sort of cheese or milk or whatever, or ice cream. What happens is that's blocking any uptake of any minerals. If you're having blockage of uptakes of minerals, what's happening, that your body's not giving you the proper things to actually have the anti-inflammatory state. So that's why I say diet is a huge component of this as well. So what you got to do is make sure that you're doing the proper diet. Make sure you're hydrating yourself efficiently as well. So back to the whole phytochemical and trace mineral thing as well. What's going on is, and I'm going to have to do a part 2 of this because I actually have to run pretty soon. But what's happening is, with this research that just came out recently, it shows about 14 different trace minerals as well as phytochemicals from natural sources are able to really take care of all of the issues that create the actual arthritis inside the body. Because again, we have to look at what arthritis really is. It's a genetic condition that actually, it can be autoimmune as well. It can be dietary, but it's all inflammation that's either mediated some sort of way inside the body. So your lymphocytes, which means the things that actually help your body get rid of infections, is one thing that we have to also control. Because again, if your body is trying to decide if this inflammation is good for you or bad for you, it's going to have the lymphocyte aggregation. That COX-2 or that histamine reaction has to be reduced. So a lot of individuals of you all that love to have the red wine, the next morning, notice how when you have the red wine, you feel dehydrated, you feel stuffy, you feel as if, you feel a little bit more inflamed. That's the histamine inside of that red wine that's creating all that as well.